Welcome to EazyMed, where complex medical concepts are made simple. In this video, we'll discuss about pneumonia, its causes, types, clinical manifestations, diagnosis, and treatment. Pneumonia is an acute infection of the lung parenchyma. Mechanisms that create a mechanical barrier to microorganisms include air filtration, epiglottis closure over the trachea, cough reflex, mucociliary escalator mechanism, and reflex bronchoconstriction. Pneumonia is more likely to occur when 1. The defense mechanism become incompetent or are overwhelmed by the virulence or quantity of infectious agents. 2. Air pollution, cigarette smoking, viral URIs, and normal changes that occur with aging. Organisms that cause pneumonia reach the lung by 3 methods. 1. Aspiration of normal flora from the nasopharynx or oropharynx. Many of the organisms that cause pneumonia are normal inhabitants of the pharynx in healthy adults. 2. Inhalation of microbes present in the air. Examples include mycoplasma pneumonia and fungal pneumonias. 3. Hematogenous spread from a primary infection elsewhere in the body. An example is Staphylococcus aureus. Now let's look onto the types of pneumonia. Community-acquired pneumonia, CAP, is an acute infection of the lung occurring in patients who have not been hospitalized or resided in a long-term care facility within 14 days of the onset of symptoms. Empiric antibiotic therapy should be started as soon as possible. Empiric therapy is the initiation of treatment before a definitive diagnosis. Hospital-associated pneumonia is pneumonia that occurs 48 hours or longer after hospital admission and was not incubating at the time of hospitalization. Ventilator-associated pneumonia, VAT, refers to pneumonia that occurs more than 48 hours after endotracheal intubation. Healthcare-associated pneumonia, HCAP, is a new onset pneumonia in a patient who 1. Was hospitalized in an acute care hospital for 2 days or longer within 90 days of the infection, 2. Resided in a long-term care facility, 3. Received IV antibiotic therapy, chemotherapy, or wound care within the past 30 days of the current infection, or attended a hospital or hemodialysis clinic. Aspiration pneumonia, occurring as either CAP or MCAP, results from the abnormal entry of material from the mouth or stomach into the trachea and lungs. Conditions that increase the risk of aspiration include decreased level of consciousness, difficulty swallowing, and nasogastric intubation with or without tube feeding. Opportunistic pneumonia. Individuals at risk for opportunistic pneumonia include those with altered immune responses. The most common presenting symptoms of pneumonia are cough, fever, shaking chills, dyspnea, tachypnea, and pleuritic chest pain. The cough may or may not be productive. Sputum may appear green, yellow, or even rust-colored. For diagnosis, on physical examination, rhonchi and crackles may be auscultated over the affected region. If consolidation is present, bronchial breath sounds, egophony, and increased fremitus may be noted. Chest X-ray often shows a typical pattern characteristic of infecting organism and is important in the diagnosis of pneumonia. ABGs may be obtained to assess hypoxemia. Pneumococcal vaccine is used to prevent S. pneumonia. Vaccination is recommended for individuals 65 years of age or older and younger patients who are at high risk. A one-time repeat vaccination in 5 years. In uncomplicated cases, the patient responds to drug therapy within 48 to 72 hours. Indications of improvement include decreased temperature, improved breathing, and reduced chest pain. Abnormal physical findings can last more than 7 days. A repeat chest X-ray is obtained in 6 to 8 weeks to assess for resolution. No definitive treatment exists for the majority of viral pneumonias. Care is generally supportive. Some important points. Patients with intubation and tubes are at risk for aspiration pneumonia. Elevate the head of the bed 30 to 45 degrees and monitor gastric residual volumes. Practice strict medical asepsis and adherence to infection control guidelines. Staff and visitors should wash their hands on entering and leaving the patient's room. Along with physical assessment, including pulse oximetry monitoring, prompt collection of specimens and initiation of antibiotics are critical. Oxygen therapy, hydration, nutritional support, breathing exercises, early ambulation, and therapeutic positioning are part of nursing management. Instruct the patient to drink plenty of liquids. Thank you for watching EazyMed. Keep learning, keep growing, and make medicine simple. Don't forget to like, share, and subscribe for more easy medical lessons.